Nearly 4 million people in the UK are living with COPD right now. But here is what's terrifying. Half of them don't even know they have it. I had a patient come into my clinic just last month. Let's call him John. He's 62, lives here in Liverpool. He had been getting breathless for the last 2 years, struggling to walk up stairs, coughing every morning. He had seen his GP 3 times, and each time he was told it's just a bit of chest infection or you were just getting older. By the time John reached me, he had already lost 40% of his lung function. And here is the thing, that lung damage is irreversible. You can't get it back. But, and this is crucial, if we had caught it 2 years earlier, we could have slowed the progression dramatically. So today I'm going to show you 5 warning signs and risk factors that are missed every single day, so you don't make the same mistake. Because early detection doesn't save lungs, it saves lives and your future independence. I am Dr. Suman Paul. I am a respiratory physician in the UK and I have my private practice in Liverpool. Over the last decade, I have treated thousands of COPD patients. From early disease we controlled effectively to advanced cases I wish we had caught sooner. COPD stands for chronic obstructive pulmonary disease. It includes chronic bronchitis and emphysema, conditions that inflame airways, destroy air sacs, and trap air inside the lungs. Once that lung tissue is damaged, it does not grow back. Before I show you the warning signs, let's talk about who's most at risk, because this matters. Number 1 is smoking. About 90% of COPD cases are linked to it. Even if you quit decades ago, the damage can take years to show itself. I have diagnosed COPD in patients who quit smoking 30 years ago. They are always shocked, but their lungs remember the damage that was caused by years of smoking. Second, workplace exposure. Construction, factories, mining, farming, welding, dust, chemicals, fumes. I regularly see patients who never smoked, not once, but still develop COPD because of what they breathe in at work. Third, air pollution and genetics. Traffic pollution, indoor smoke, and in rare cases, a genetic condition called alpha-1 antitrypsin deficiency. If any of this sounds like you, listen carefully. Here are the 5 warning signs that you can't ignore. The first one is a chronic cough. Not a cold, not flu, a cough that's been there for months or years, especially with mucus in the morning, as my patients often describe. Cough first thing in the morning. There is no such thing as normal long-term cough. That's your lungs inflamed, producing excess mucus and begging for attention. Second, breathlessness that creeps up on you. You park your car closer to the shop or your office. You avoid stairs. You stop walking after 20 to 30 minutes, whereas you could easily manage 1 hour without any problem. You tell yourself, I am just getting older. You are not. Your lungs are struggling. If you are more breathless than people your age doing the same things, that's a red flag. Third, frequent chest infections. Bronchitis every winter, colds that go straight to your chest, hospital admissions that keep repeating. Each flare-up causes permanent lung damage every single time. Fourth, wheezing or chest tightness. That whistling sound when you breathe out, that squeezing feeling like you can't take a full breath, that's narrowed airways and trapped air in your lungs. And fifth, persistent unexplained fatigue. Not tired, exhausted. Because breathing shouldn't feel like a workout, but in COPD, it actually does. Your body burns energy just to stay alive. Now listen carefully. If even one of these signs sounds familiar, the most important step is simple. Get tested. The test is called spirometry. 10 minutes, painless, blow hard into a tube, and we can see lung diseases years earlier than symptoms alone. And here is what most people don't understand. COPD is a silent disease. It creeps in slowly, so slowly that people adapt. without realizing they're adapting. In the UK, about 1.3 to 1.4 million people are diagnosed to have COPD, but the real number is close to 4 million. That means millions are walking around with damaged lungs, unaware. And on average, people wait 7 years between first symptoms and diagnosis. 7 years of preventable damage. COPD has no cure, but caught early, it is absolutely manageable. Treatment can slow progression, reduce breathlessness, prevent dangerous flare ups, and keep you active for years. I have patients in their 70s and 80s living full lives because we caught it early. But every month you wait means more damage you can't undo. If you are in the Liverpool area or the northwest of England and you are concerned, you can book a consultation directly with me. Details are in the description box below. But whether you see me or your doctor, please don't ignore it when your lungs are trying to talk to you. Listen before they have no choice but to scream. I am Dr. Suman Paul, and in my next video, I'll be talking about the biggest COPD treatment mistakes I see patients make and how to avoid them. Take care and breathe easy.